Continuing from a theme of our last segment about bringing awareness to the risk and presence of cancer, we have joining us this morning back Dr. Antonio-Collie, Chief Medical Officer, Medical Director, Doctors Hospital West System. Of course, she's going to be probably a permanent host here at Moms and Sunrise soon, the amount of appearances she's made thus far. And Dr. Theodore Turnquest, Medical Oncologist, Clinical Director of Laboratory Services and the Doctors Hospital Healthcare System. Good morning. Welcome back to Bahamas at Sunrise, doctors.
Good morning.
Dr. Antonio-Collie, you've got a new doctor with us this morning, Dr. Turnquest. He's a board certified medical oncologist. Introduce him to us.
All right. So Dr. Theodore Turnquest is, like you said, a board certified medical oncologist, having trained at H. Moffitt Oncology Center in Tampa, Florida. With a wealth of experience in medical oncology as well as hematology. Dr. Turnquest is a consultant at Princess Margaret Hospital and was head of the Department of Medicine there. But he's also the clinical director of laboratory services at Doctors Hospital. He has his practice. He's an exorbitant amount of cancer patients, and I know that Dr. Pinto was on about prostate cancer, and he has seen it all, so to speak. And he has been a great source of assistance to us at Doctors Hospital for our cancer treatment program, as well as during this COVID period with laboratory services, as well as trying to keep our patients, especially our cancer patients, safe and protected. And so he's going to talk to us about a bit about cancer and COVID and how we're going to be keeping people safe.
Well, thank you so much, Dr. Turnquest. Welcome to Bahamas at Sunrise.
Well, thank you for having me.
Well, that's a serious combination there when you start talking about cancer and COVID. Obviously, you keep on saying this, 2020 has been a year like no other. But why does having a cancer diagnosis increase the risk of getting COVID-19?
Well, usually most patients that have a cancer diagnosis are in some way immunosuppressed. And so because their immune system is not 100%, either due to treatment or the malignancy itself, then obviously their risk for infections actually increase beyond that of the normal population.
So does that mean then if you are, receiving treatment for chemotherapy or radiation therapy, should you kind of postpone that treatment, or is there an option to even postpone treatment?
So the short answer is no. The longer answer is a little bit more complex. What we learned early in this pandemic through our colleagues in Italy was that some cases or some patients can be safely postponed. But we found out as the pandemic sort of lingered on, that a lot of those patients needed to actually be started on therapy. What we're now running into, though, is we're now running into the fact that people have not come in for screening, people have not had scheduled surgeries, and people have not had scheduled interventions. So what we're anticipating is we're going to have people showing up with later stage cancers because of the delays that are happening.
And these delays are primarily related, obviously, to the fear of COVID or the availability of the system?
Well, both. So the fear on the patient's part about going into hospitals or going into clinics and being exposed to COVID, but also the delays that have happened. Restrictions in travel have had a significant impact on oncology care, both between countries and within countries. Therefore, decreased access to experts and the like. Also, decreased access to radiology services, once again, surgical services. All of that is a combination of delaying both the diagnosis, but also the therapeutic interventions that are needed.
What about blood transfusions? Obviously, COVID, we've learned so much about this particular virus and disease over the last several months, but is there risk associated with blood transfusions?
So as part of my role as clinical director of the lab and also as a hematologist, the thing with COVID has actually been an evolving paradigm for us. The short answer to your question, though, is no. We already have in place a robust system that actually screens out individuals that may have been exposed or have an acute infection with COVID. So as it now stands, we don't take patients that may have COVID during the transfusion process. Now, there's a long-term portion of this though, because this is something we've just been doing for the past, 6 or 7 months, and nobody's quite sure long-term what this is going to look like. But currently, the blood supply remains safe. The current testing paradigms are very robust, and there's been no reported cases of transfusion-related COVID infection.
Okay, all right. Listen, thank you so much, Dr. Theodore Turnquest, Dr. Antonio-Collie. I know I've spent a lot of time just interviewing Dr. Turnquest, but again, how do people, I mean, we can't say it enough, how do people continue to boost their immune system? How do persons continue to protect themselves, not just for today, but certainly going forward?
Well, I think from the immune system standpoint, one of the things that have come out with this COVID is exercise, daily exercise, and diet modifications. But the other more important thing is we need to get back to appropriate screening. We've put screening on hold for about 6 months, and that is going to come back and cause a problem for us later on. For those viewers out there, let's get back to the normal routine of daily exercise, weight management. We know the risk factors associated with poor outcomes from COVID, obesity, hypertension, diabetes, and the like. So control of medical illnesses is going to be key in this.
All right. Dr. Antonio-Collie, I'll give you the last question like I gave you the first. We talk about capacity of the system, the weight of what we've been going through. Can you tell us how things are at the Doctors Hospital healthcare system and why it remains the best place for care? And where can we find more information if it is necessary for anybody to visit any of the facilities?
Okay, so yes, Doctors Hospital, we continue to try to rise to the challenge of capacity. And presently at our Doctors Hospital West facility, we're in the process of expanding our bed capacity there for the treatment of COVID positive patients. So those plans are in place and should begin construction on them this week. So it's definitely something that we're fully aware of, that there is issues both public and privately for bed capacity. And so we're trying to rise to the challenge of that. Obviously, we continue to test, treat, as well as trace COVID-19. And so if you need any information, you can go to our website at www.doctorshosp.com. Our mainline number is 302-4600. And you can ask for anyone, you can ask for me, you can get more information. You can speak to Dr. Turnquest, especially if you're a cancer-related patient and you need more information about your screening and where to go. And so definitely, we're trying to do our best to come around side and win this fight.
Thank you so much. The fight, the war continues. We appreciate you guys very much.
All right. Thank you for having us.
All right, great.
Thank you. Have a good day.
You too. Watching Bahamas at sunrise. We'll be right back.